Hey everybody, this is Dr. Weld here at the Regenerative Medicine Institute. Today we have a patient with post-reconstructive surgery pain associated with breast cancer. So she's basically 3 years cancer-free. Good job. And this has caused some development of adhesions on the superior side up in here, as well as where her scar tissue is over here. And then of course she has some really tender areas right in here, which is she considers a cord. It causes pain to the point where she can't wear a brassiere, and that's basically what we're going to be treating today. So we're going to be doing post-reconstructive breast cancer scar tissue treatments. The treatment of choice for this is going to be a combination of neural prolotherapy with prolozone. So when we do these injections, you want to make sure that the opening is actually up, so the sharp point of the needle goes down. Some tissues you can bend the needle so it's at a 45-degree angle, which will actually help out. She's got some adhesions right here and a little bit of pain right there, right? Uh-huh. Yep. So we've already marked that. So we're basically going to get right down in there and start to open up those tissues. I'm going to put about a half cc to 1 cc per area in these adhesions in here. Now we have some Gebauer spray or some cold spray as well for the patient if she really needs it. She's about ready to hit me, I think. So, doing okay?
Just stings.
But at least she can feel. So, so those are the deep tissue muscle ones. Now we're going to go ahead and get some of the more superficial ones. Most of the scar tissues that you will see during these types of treatments are actually C-section scars. Very, very common. Right where they do the C-section, midline, you'll have that nice little X in there. And the patients will tend to get really tender in there. How you doing? Mm-hmm. Okay. Any pain so far?
No feeling.
No feeling. Okay, good. So what I'm doing is I'm basically injecting a half a cc to a cc each area, and you can see me moving it around, dissecting it.
Yeah, that stings.
That one stung?
Mm-hmm.
So as we get a little bit more over here, she's getting a little bit more sensation. Mm-hmm. The injection themselves, ooh, right there. That's a good one. Yeah, lots of resistance right there. Mm-hmm. So that is a good indication of where the scar is. So we're going to make sure that we get this area really good. She's not going to like me too much in a second.
Already there.
Yeah, right there.
No, I'm already not liking you too
okay.
much.
Okay, good. Just making sure. So she's saying it still stings, but this substance that we're using here typically actually gets rid of pain. So she's got hypersensitivity in these areas. Now, normally that's a bad thing, but oftentimes we can normalize the tissue sensation with this neural prolo, which is basically what we're doing here. Now, she doesn't have any implants, so very comfortable doing these types of treatments along the reconstructive line. If she did have implants, we do want to make sure that we delineated the implant area itself. So right there is pretty tender, huh? Good. So that is the hydrodissection portion of it. Now we're going to go ahead and start up with the ozone itself. Here we go. We're going to go ahead and start over here. Good. Now this, sometimes when you feel these adhesions break up, you will literally see it expanding out, which is what you can kind of see it blowing up through here. There we go. That was better. The harder it is to put the plunger in or to press the plunger in is, the more scar tissue there is around there. There we go. Got one more out of this. There we go. Good. Let me go ahead and get some more ozone and we'll continue on. Now the patient was saying, oh, there you go. There was a good example of where you can see the ozone actually spreading to. So there it is again. Beautiful. Just beautiful. Doing good.
Really, really, really painful right there.
So the patient was saying that she doesn't have a lot of sensation anywhere else really except for right in the middle. So you doing okay?
Burns.
Yeah. So she's saying it's burning. That's from the ozone itself. So ozone can burn at times. You can reduce that with using Gebauer spray or a local anesthetic. So when we're doing these injections here, she actually feels it a little bit more when she's sitting up. So you have to push a little bit harder right there.
Right in there, yeah.
Right there.
You can feel the cord.
Yeah, I can feel the cord. Here we go. There. Oh yeah, nice and gritty.
Oh, that really aches. Is that supposed to cause a dull ache all the way through to my back?
Well, that's where the muscles go, right?
Holy cow. Oh.
There we go. Doing good.
Oh, Lord. Ow, ow, ow.
I'm almost done with this one.
Ow, ow. Okay, that really hurts.
Okay.
I don't like you anymore.
So I wonder if some of your back pain's coming from there, huh?
That's exactly what I was just thinking,
Yeah.
because it goes all the way into that area right under my shoulder blade that hurts all the time.
And that's where you're feeling the pain right now?
Yeah,
Oh, look at that.
all the way across. Ooh.
So look at that. So the patient has back pain, and when we're injecting it, we're causing those tissues to actually expand. And she's saying, wow, that's exactly where my back pain is that I've been having. So thing to consider. So we're going to go ahead and switch that up to the ozone.
Oh, great.
She already doesn't like the ozone. So we're going to start up here.
Ah.
There we go. Beautiful.
Oh, Lord.
There we go.
Whew.
Good. Dissecting those tissues really well. I'm just checking.
Whew.
Yep, we're done.
Okay.
So now she's relaxing. So there you have it. There is a scar tissue treatment for post reconstructive breast cancer surgery.